Hi everyone, thank you for joining us today on the Equal Hope segment on CAN TV. My name is Leilani Lacson and I am the Data and Communications Coordinator at Equal Hope. For those of you who are tuning in for the first time, Equal Hope is a nonprofit organization whose mission is to eliminate health disparities in Illinois. So we do this by offering free services such as mammograms, cervical cancer screenings, and assistance with getting vaccinations such as the flu shot, HPV vaccine, and the COVID-19 shot and the booster shot. And we provide more services. So check us out at equalhope.org or give us a call at 312-942-3368. I'm also excited to announce that Equal Hope now has cancer support resources for patients, caregivers, and providers. You can also find us on social media. So this month's guest is Dr. Tomitra Latimer. She is a pediatrician at Lurie Children's Hospital and assistant professor of pediatrics at Northwestern. Dr. Latimer, thank you for joining this month. You are no stranger to Equal Hope. You were on a radio show a few months back to talk about COVID-19, the vaccine, and children. So Dr. Latimer will discuss with us COVID-19 and children and the vaccine and updated guidelines. This is perfect timing because this month is National Immunization Awareness Month, and also because children are in school now or will be returning to school soon. Over 14 million children have tested positive since the onset of the pandemic. It has been previously known that children are at low risk for COVID-19 infection and seem to be spared from severe impacts of COVID-19 that could result in mortality. However, the indirect effects stemming from strained health systems and disruptions of life-saving services such as immunizations and pediatric care can result in devastating increases in COVID-19 infections and mortality among children. Therefore, it is important to keep up with new vaccination guidelines that have adjusted the age eligibility for your child to get the COVID-19 vaccine and booster shot. We will be exploring these new COVID-19 vaccine recommendations and much more today in our discussion with Dr. Latimer. Dr. Latimer, tell us a little bit about yourself and how you got involved in medicine.
Okay, thank you so much for having me. I'm really excited to talk about this really important topic. I am a pediatrician and I'm the clinical practice director of the Division Advanced General Pediatrics and Primary Care at Lurie Children's. And I oversee the 2 primary care clinics that our goal is to provide care to high quality care to patients 0 to 21. Many of our patients have multiple complex medical problems. Many of our patients come from disinvested communities. Many of our patients have Medicaid and are really dealing with a lot of social stressors that's been exacerbated by COVID-19.
And you also teach too at Northwestern.
That's correct. So I teach medical students and I work super closely with residents, and it's one of the highlights of my position here.
Great. So you were a radio show guest, I think it was earlier this year, sometime last year, and the COVID-19 vaccination guidelines were different. It was either there wasn't a vaccine available for children or only certain age range could get vaccinated. So tell us, what are the current COVID-19 vaccination guidelines for children?
Okay, so yes, that's a new development. That's an exciting one. Before, the vaccine was really available for children 12 and up, and now it's available for, first it was 5 to 11, and now just recently 6 months and older. So now we can provide vaccines to the very, very young patient.
Great. And it's a really big breakthrough and a sigh of relief for many parents, I bet.
Yes, it totally is. Many parents have expressed, concern. When is this vaccine going to be available for my infant? What's it going to look like? Where can I get it? And now we can provide that experience at Lurie Children's and many other sites. Walgreens can provide the vaccine, some schools. So we're really excited. I think this is another tool in the toolkit to combat COVID-19.
Mm-hmm. It definitely is. So in your clinic, describe what the impact of COVID has been like for children and for especially your patients.
So especially during the time when there was remote learning, so in 2020, I noticed when patients would come in for their checkups, there was a lot of fear and anxiety around the pandemic. And a lot of children and their parents too were suffering from depression and anxiety, not knowing when they were going to see their friends. Their sports and activities were all canceled, so they couldn't go and hang out with their friends or play basketball. And then another thing that happened is because they were at home, spending all this time with remote learning on the computer, they gained a lot of weight. And so we really saw a lot of anxiety, depression, weight gain related to the COVID-19 and this remote learning.
Do you feel that there were more children who got sick during the time period when people couldn't go out and do things because they couldn't go to the hospital because they were scared to step out of their home?
That were more sick with COVID-19?
I mean, like if children had chronic health issues and they had to go to see a doctor regularly, do you think children got more sick because their parents were too afraid to send them to the hospital and be around other people who might possibly be sick, or go on, the CTA where you're surrounded by a bunch of strangers?
Yeah, it's a great question, and I'm not sure of that, but what I can tell you is patients or parents were hesitant to bring their healthy children or bring their children to the regularly scheduled checkups where we would give them their vaccine. So we saw a lot of patients that were delayed in their well child care visits and therefore delayed in their vaccination. So there were a lot of children that were not up to date with their vaccine.
Okay.
And I know that for adults, that for patients that needed to come in to the emergency room, sometimes they were so full, they were not able to be taken care of. I don't think that we had that at Lurie, thankfully, but the vaccine being up to date was an issue.
Okay. So the reason I ask is because since I do the social media for Equal Hope, a big thing is cancer doesn't pause during a pandemic, and how experts and doctors are afraid that after we get through this pandemic, there are going to be more cases of women with breast cancer, but the diagnosis is at a later stage because they put off their screenings. They didn't want to go to the doctor. They didn't want to be, around people who could possibly get them sick for, various reasons why people couldn't see a doctor.
Yeah, I see what you're saying. I think it's a good point. I think that in the pediatric world, or at least in our clinic, some elective procedures were postponed or delayed, like dental cleaning, but I believe that the procedures that really needed, that were life-saving, were able to be continued. And I think the biggest reason is because children were not as impacted. The incidence wasn't as high as it was with adults.
So what would you say about vaccine hesitancy? So one of the things I wanted to mention was that Chicago Public Schools doesn't require vaccination for their children. Would you say that vaccine hesitancy has increased, decreased, or stayed the same during these past 2 to 3 years?
I would say that it's either stayed the same or a little bit decreased, and especially for the younger ages, 6 months to 4 years, that's now available. I have found parents that are not interested in their children getting this vaccine. And so and then for the younger or the older children, sometimes parents are, their children has already received it, but they're not interested in getting the booster. And so I would say that it's about the same or a little bit, increased. The hesitancy is a little bit increased. And I heard that in CPS, Chicago Public Schools, I believe only 40% of children are vaccinated.
Yeah.
That's a pretty low number.
It is a low number, and it's, not a requirement. So if it's not a requirement, then, You know, if you're a parent and you're against vaccination, why would you vaccinate your child? What are some reasons why parents don't want to vaccinate their children, or even, as you mentioned, why don't they want to continue the series of vaccination and get their child boosted once they become eligible?
I find the biggest reason is if the parent is not vaccinated, then they don't want they're not interested in their children getting vaccinated.
Okay.
Or if they're vaccinated, their concern is the vaccine is just so new. They don't know a lot about it, and they're just worried. And they've even said, some parents have said, I just want to wait a little bit to let some time pass and see what the reports are about how other children are doing.
So how do you overcome objections of parents or caregivers?
So one is, I will say, we can give the vaccine here. Sometimes parents are like, I don't want anyone else to give it. And I'll say, hey, at Lurie Children's, we can administer the vaccine. It's given by an experienced nurse, to relay or minimize some of those concerns. I also say that, yes, it is true that children do not get as sick or have not gotten as sick as parents or older patients. But children have gotten sick and have died, and this vaccine can be very effective in minimizing those symptoms. And when your child is protected, then we can make sure that everyone in the family is protected. So even, the grandparents who might be at greater risk. So that's what I try to mention. And one other thing I say, this vaccine, yes, it is new, but it's been studied even before it was rolled out. And it's being administered not just in Chicago, but other states and all states in the US and many other countries. And so there's a large, huge database that's really monitoring and really ensuring that this is a safe vaccine.
And one thing to point out also is that these vaccines continue to be monitored for safety, even though they're widely available across the country. Safety is still important. These vaccines are still monitored. So in simple terms, describe how they're monitored. What are some methods that the government does?
So the vaccine safety surveillance program, if you got the vaccine, you might have received a text from the CDC. So shortly after you got the vaccine, and then after the second dose and the booster, questioning how are you feeling today, what kind of symptoms are you having. So that's one way that they're monitoring the vaccine. And then also in your doctor's office, if you get the vaccine there and you present with symptoms, then your physician will have that information and report that. So that's really the biggest way that they're monitoring these vaccines. And again, I must say that the side effects are similar to other vaccines. So fever, pain at the injection site, fatigue, joint pain, but these are all temporary, nothing compared to COVID-19 infection, especially when it's severe.
Can these side effects, which are minor and go away in a few days, can they be treated at home, and how can they be treated at home?
Yeah, it's a great question. Yes, it can. So it can be treated at home with ibuprofen if they're old enough. If children are old enough, you have to be 6 months and older, or acetaminophen, making sure they're drinking lots of fluids. Of course, we would get concerned if you had the infection or you had some side effect that was more serious from the COVID-19, which was it's very rare. If you're having difficulty breathing or not feeding well, or you're confused, your mental status is changing, or you seem blue, those would all be reasons to go to seek medical care. But again, those are super, super rare. And these symptoms are temporary, as you said, and will go away.
So there is a condition that has come up when the vaccines became available for children. People started talking about multi-system inflammatory syndrome. How is this related to COVID-19, and what is it?
Yeah, so multi-system inflammatory syndrome in children, or MISC, is a condition, and they don't really know a lot about it. Yes, it's been associated with COVID-19, but the pathophysiology, who gets it and why, is still being investigated. But what we do know is that it is an inflammatory condition. That means that many organs are inflamed so that they don't work as well. And it's multiple organs that are involved. The heart, the kidney, the brain, the gut, and you can have multiple symptoms associated with that. You know, problems with breathing, chest pain, derangements in your cardiac function, your kidney function. You can have skin rashes. I mean, it's just really multiple systems are affected, and you can become very, very sick.
Okay.
But thankfully, it's pretty rare, but they're still needing to do a lot more research on it.
Okay. So people ages 5 and older can now get a booster shot. Explain why booster shots are important right now.
So booster shots just further enhance and boost the protection that was given from the primary series. Oftentimes, the primary series, kind of like the influenza vaccine, every year you need a flu vaccine because the protection that you received wanes or decreases over time. And so, you know, if you think about the first vaccine that was administered or was available was in December of 2020. And if you got your primary series and the booster, or you got your primary series then your immunity, your immune response is a little bit decreased or waned. And this booster shot is a way to give it a little boost, an injection, so that it can fight off COVID-19. Or if you do become infected, it can minimize your symptoms so you do not have to be in the hospital.
And booster shots are not a new thing.
Oh, you're exactly right. Many vaccines that we give in childhood have a booster. So examples are the pertussis vaccine. An example is pneumococcal. So many vaccines that we give in childhood have a booster, again, to just boost the immune system so that it helps to rev it up, wake it up, teach it again to be mindful and look out for the COVID-19 and know how to combat it.
A saying that I like to post on social media about booster shots is that boosters make you stronger.
Yes, that's right. Yes, they do. Yeah. And to answer your question about why some families sometimes, you know, decide not to get the booster, or their children, is sometimes the side effects. They say, wow, that was just tough. I didn't like the way I felt. But again, you know, I try to counteract that by saying it's temporary, and it's just, like you said, it's boosting your system, allowing you to fight COVID-19. And we don't know what the winter holds. We're going to be in school. Many masks are not even permitted anymore. And we're not sure what the flu and the COVID-19 season will bring along with those other viruses. So really encourage everyone to get boosted get a booster if they're eligible.
And it's 5 months after your initial vaccine series, correct?
That's correct.
Okay. So what are some things that put children at a greater risk from catching COVID-19?
It's similar to adults. So children that have chronic medical problems like asthma, like chronic lung disease, patients with sickle cell disease, patients with diabetes, patients that have an elevated body mass index or obese, they're also at increased risk for getting really sick and requiring hospitalization. One other group is patients that are immunocompromised, so patients that have transplant, you know, an organ transplant, a kidney transplant, or whatever reason they have to take medications, medications that suppress their immune system.
What makes a child ineligible for the COVID-19 vaccine?
So patients that are allergic to the additives or ingredients in the COVID-19. So let's take Pfizer and Moderna, which are the vaccines that are given to children. They both have similar ingredients. They have lipids, a kind of a fatty material. Polyethylene glycol is one example, and then polysorbate. And if you're allergic to these medications, polyethylene ethylene glycol is found in a number of medications.
Mm-hmm.
Miralax is one. So that's a medication
Yeah.
for like constipation.
Yeah.
If you're allergic to that and a severe allergy, then it would not be a good idea for you to get the COVID-19.
And how rare is that?
You know, I don't know how common that is. I've certainly never come across that.
Yeah.
And so I would imagine that it's pretty uncommon, but I'm sorry, I don't have the exact numbers on that.
It's okay. I was just curious because
Yeah.
it just seems like it might be something that's not very common.
No, not common. Mm-hmm.
So the latest thing that the Chicago Public Schools has announced is that if children are exposed to COVID-19, they don't have to quarantine. But if they do start, testing positive and showing symptoms, they have to. How do you feel about that new policy about quarantining?
I understand. It was very, very disruptive when a child in the class that tested positive, but the patient themselves did not have any symptoms. It was really disruptive to the parent who had to take off school, take off work, or pick up the child, find childcare. So I understand. And I support it. I guess I would be more on board if there were a mask in place. Use of high quality masks, because I then think that if you're not having symptoms and you've had an exposure, meaning someone in the classroom or in the building is positive, but you've been wearing a mask, that really minimizes your risk. And if you're vaccinated and have a booster, that really drops it down. So I think I would be much more on board with this policy. It would make a lot more sense if there were other pieces to the breaking the code of the COVID-19 were in place. But I get it. It's super disruptive to everyone. And I understand why they decided to go this way. And I understand the pushback is making a requirement for people to get vaccinated and wearing a mask. I get all that.
So for parents and caregivers out there who are watching, where can they take their child to get vaccinated? What are some places that are convenient for them?
So some schools, so I would definitely check with some schools, but even closer, that's probably in their backyard, is your local pharmacy. So Walgreens, CVS will all vaccinate children if you're 3 and up. I think the issue becomes if you have a young child, you want them to get vaccinated and they're 6 months and older, where do you go? And so Truman, so some of the the City of Chicago places can, but also the website, www.chicago.gov will have a list of some sites, and the cdc.gov might, but if you want to keep it local, I would definitely look at chicago.gov. They definitely have sites, and you can search according to your age.
Okay. So we have about a minute and a half left. What are some things that parents can do besides vaccinating and boosting them? What can they do to keep their children safe?
So things that parents can do to keep their children safe during this pandemic is making certain that their children are up to date with vaccines. So including the influenza vaccine, we're soon going to be entering the flu season. And so in September, October is a great time to get vaccinated against influenza and other vaccines. To use a high quality mask in crowded or indoor places. So maybe you don't want to use it in the classroom, but if you pass the hallway when there's a bunch of people, maybe that might be a good time to wear the mask. Good hand washing, and then not going to school if you're sick until you get tested to make certain that it's not COVID-19.
And these are simple steps that we all can follow.
Yeah, definitely.
Okay. Well, thank you, Dr. Latimer, for being on our show today. We really appreciate you taking the time to explain to us the status of COVID-19 and vaccination in the U.S. and especially in Chicago.
Thank you so much. I really enjoyed talking with you. Thanks for having me.
Thank you. And join us again next time on September 27th from 5 to 5:30 p.m. for our next episode on CAN TV. Thank you, everyone, and good night.